Hi, my name is Allison Reed, and I will be presenting my research proposal on pediatric surgical education, the Little Surgeons Clinic. In this proposal, I will talk about the introduction and problem that I've identified, the background of this study, my research question, the literature review presented, my theoretical framework methods, the instrumentation that will be used during this study, the different procedures, how subjects will be recruited, the benefits and risks, the informed consent processes, and then, of course, my references. For this research proposal, the population is the pediatric umbrella in surgical cases and in the environment. With this environment, it causes increased anxiety due to patients in this age range. They have no reference to what happens during surgery. They've never maybe been in surgery before. It's very unfamiliar. There's a lot of bright lights, lots of like movement, big pieces of equipment. It's just very unfamiliar to them, and they have no reference. The language and conversation that is happening leading up to surgery, they're so unfamiliar with it, and they don't know what it means. They don't know what's going on. And once again, leading back to they just don't have that reference. Education for this population should really be tailored to the appropriate cognitive level. So for pediatric patients, they should be able to have terms that are used that they understand and be exposed slowly to different things to have a better reference to kind of create this environment that decreases that anxiety. For the pediatric population's cognitive levels, interactive play is a great source for education for these patients. And if you take it to the surgical environment, it just really sets that stage for the patients to be comfortable and have the knowledge in just leading up to their surgery, have a better platform and understanding. So a little background on this research and the information that is out there. Hospitals have been trying to close the gap around anxiety for the pediatric population and have stated many different approaches to execute it. There's examples out there of coloring and interactive play with dolls and teddy bears, and there's even games and simulation that kids can be involved in to try to help make them become more familiar. But the end goal is just leads to increasing that comfortability and relation with those patients to really try to set the stage for them to feel more comfortable, for them to really decrease that anxiety in an environment that they're unfamiliar, where anxiety is already heightened. So with that, the research question is really built around, does creating an interactive play or pediatric surgical clinic where it's very interactive in all levels of the environment increase that comfort and understanding of the surgical environment for these patients? And it's really to determine, is it appropriate for that population? So within my literature review, a lot of these were random controlled trials, and they instilled some type of therapeutic play versus routine play, routine care that these patients had, and some of them showed very favorable outcomes. There was mixed reviews, lots of decrease in anxiety. Some even pinpointed increase in patient and family satisfaction, like these articles here, and leading into some different ones as well. using standardized tools and stuff like that to really zone in of, are they decreasing anxiety and all of that kind of stuff. Booklets and touring were really a driver for that, and it really was showing that decreased anxiety and increased patient satisfaction. I chose Jean Watson as my nursing theorist for this research project because she really encompasses the human caring model. And within that, you're thinking of well-being at the forefront for that patient, and understanding the environments that they're in helps grow patient trust, and just overall encompasses the holistic view of a patient. And you can do that with supporting and creating those educational opportunities that increase the patient's comfort. So Jean Watson's human caring model really supports the interactive education for these patients, and really drives home creating that environment that makes them feel more comfortable. So within this research project, ideally it would be done at Stormont Vale Health Excellent Surgery Center. This is an environment that a lot of surgical pediatric patients go to anyways. They do high volumes of ear, nose, and throat procedures, tonsils, adenoids, ear tubes on this population, which will allow them to feel more comfortable and have a higher chance of being in that environment. The design will be convenient sampling, which is just setting up kind of a little area to provide information on a questionnaire using a Likert scaling on how they feel this education interactive play was for their kid, their child, or their pediatric individual that they bring to this educational opportunity. This survey would be a post-intervention, so information would be given at the beginning that we're conducting a sample survey. If you're interested, it would be available at the end of the education today. Like I said, instruments that would be used, it's a 5-question survey using a 5-point Likert scale from strongly disagree, kind of that neutral, agree, and strongly agree. And it's really just to evaluate the effectiveness of that interactive education that was provided in the session that was done today. So the procedures that would be done is completion of the Little Surgeon's Clinic, which really passionate about education and providing this to our patients. So ideally, they would go through the registration process, right? Picking out their teddy bear, registering their teddy bear, you know, pre-opping them, getting them ready, you know, providing a interactive like anesthetic, because usually that's the scariest part for these patients, is going under anesthetic and just that unknown. And so really giving them the opportunity to get the hands-on portion and really engaging in that process. And then of course a little fun, like playing with the instrumentation and that kind of stuff for surgery, scrubbing into the case and that kind of stuff, and being able to understand kind of that fun process. And then of course taking their patients to recovery and really kind of lightening that recovery and seeing that they come out of recovery after surgery. And of course the completion of the survey would be done after that education is provided to that participant and the participant's parent. So for recruitment of this convenience sampling within the project, ideally would be done through advertisement through the Topeka ENT surgery office, and then this project will come about working with the Stormont Vale's Day in a Life offerings. It really reflects some of the aspects that they use with the adult population and giving them a inside like lens to behind the scenes work of of operations in the hospital. So pairing with them to help recruit and build this program, and then doing the research and kind of getting it out to those community members if interested. From the different sessions, would ideally like to have 10 to 20 consented participants fill out the questionnaire to really gauge to see how they felt this benefited the child that came to the different sessions and their outcomes. So when talking about risks and benefits, there's really a minimal risk to the participants and the guardian for filling out the survey. Benefits is just really the knowledge gained that they're receiving and the education that's being received. And then, of course, they get that exposure to that surgical environment. What does it look like? And kind of just hopefully decreasing that anxiety and increasing comfort by being exposed to these areas and kind of having that more familiar environment that they have. As this participation is on the pediatric population and they are considered a vulnerable population, parental consent would need to be obtained, and an assent form would need to be obtained both before conduction of the survey. Participation is completely voluntary, and either the pediatric individual or the participant's parent, guardian can withdraw at any time. There is no cost or compensation for participation in this survey, and the confidentiality and privacy will be completely disclosed, and all of these documents will be locked in a drawer in the surveyor's office that no one else has a key to except for the surveyor. And these are my references for my research proposal. Thank you so much for your time and listening into this proposal.